All right, so today I'm going to walk you guys through how you can start to gather a little bit more information about your elbow and where you currently stand or what your current baseline is, so that you can start to learn how to self-assess your elbow and test or find out what might need work for you specifically. Now, what most people don't know about the elbow is that it's actually, the primary motion of your elbow is not bending and straightening. Yes, that's what we do a lot of with our elbow, but the primary movement of your elbow is actually rotation. So your ability to flip your palm up and flip your palm down. Now, your ability to do so actually speaks to the health of your capsule, which is the very, very deep tissue in your elbow, which is often neglected and also really important to address if you have hypermobility in your elbow, which we'll kind of circle back to later, and I'll teach you guys how to kind of look for that. But also if you have a history of elbow issues like tennis elbow and golfer's elbow, so commonly people will find themselves with those types of problems. And then when they try to address it or they do their rehab, they do a lot of, wrist strengthening or wrist exercises, but they don't do anything for elbow rotation. And in many cases, that's a limiting factor. So if it's a limiting factor in your case or in your body, you might find that you do all the wrist exercises in the world and it maybe gets better temporarily or it doesn't get better, but then it just comes back again. And again, if you have unhealthy deep tissue in your elbow, that can actually predispose you to things like tennis elbow, golfer's elbow, and just general elbow problems, which can often feed into that recurring cycle of elbow issues. So like I said, today I'm going to show you guys how you can start to learn to assess for those things and start to find out, is that maybe something that's going on for you, or does the deep tissue in your elbow need some attention, so that you know. And then I'll also walk you guys through how you can use the subscription or the classes available in OHF to then start to work on addressing some of those deficits that you might have or not have in your elbow. So we'll dive right into it. So like I said, most important movements of the elbow is actually rotation. So it's very easy to check bending and straightening, and we'll circle back to that after, but we'll start with the rotation component. Now, if you have a yoga block or something like a rolled up towel or anything similar accessible to you, you're going to take that and you're going to tuck it right between your elbow and your torso. Don't make the mistake of putting it too high and then leaving your elbow kind of overhanging. You want to put it right between your elbow and your torso. And then I'm going to ask that you bring yourself to in and around 90 degrees and try to stay at 90 degrees of elbow bend. So rather than being up here or up here, we'll assess you in and around 90. Then you're going to take your stick, okay? Now, the stick is not necessary, if I'm being completely honest. It's helpful to have for some of the exercises that I'll show you after in terms of how you can start to work on these things, which is why I'm going to have you start with the stick. But you could assess yourself without the stick as well. What I'm going to do, though, is I'm going to test, because the stick will give you guys a better visual over there. I'm going to test how far I can rotate my elbow palm up. Now, notice when I do so, I actually have a bit of an angle on the stick, so the inside of the stick has come up higher than the outside. Now for me, that means that I have normal, what we call elbow supination. So that means that I'm able to rotate my elbow not only to neutral, but past neutral, such that my forearm, or my wrist I should say, is actually angled this way right now. So when you're looking down at these veins on your wrist, what you want to see is that when you look at those veins, they're actually angled this way. Now, what you can also do is you can take something, I'll often use the analogy of a cup. If you were to balance a glass of water on your wrist, it should fall to the outside of the room. I don't have a cup, but I do have about 1 million of these duckies because my clients have been planting these around my clinic as a prank or to troll me, and joke's on you guys because I finally have a use for these things. So I'm going to use this. You could use anything. This has a flat bottom, so it's going to work perfectly. So I'm going to put it on my wrist, and if I have normal elbow supination, not only would it get to the point where it's flat, okay, but with my elbow staying bent to 90 degrees, ideally, when I rotate my elbow, it falls to the outside. If it's falling to the inside, or that angle of my wrist is angled this way instead of this way, that's an indication that we have limited elbow mobility. or at least elbow supination. Okay, so when you rotate palm up, what we're looking for is that the inside of that stick gets higher than the outside. When you look at your wrist, you should see that those veins, or that area that houses the veins on your wrist, is angled this way. And if you were to place something flat on your wrist, it should either stay flat, which is like close to normal, or even fall to the outside, which means that you've got normal elbow range of motion in elbow supination. Now, let's look at elbow pronation, which means just rotation in the opposite direction. So same thing here. I'm going to take my block, I'm going to maintain it at 90 degrees of elbow bend, and then I'm going to test. If I rotate palm down and I go in this direction, what I should see is that I can get the stick basically flat, and if I were to balance something on the top of my wrist, that it can balance there. So what you wouldn't want is to be stuck this way and to have your wrist angled like this. You want to see that the top of your wrist, or your surface that you would have your watch face on if you were wearing a watch, like I am on this side, that watch face should be pointed directly up and not still over towards the right side of the room. So we don't need on this one for it to fall inwards. We actually just need you to be able to get to a point where it's about flat. If you can get to that point and you see that, oh yeah, your watch face is pointing straight up at the ceiling, you can balance something on your wrist there and it stays there, you've got a totally flat surface, then again, you've probably got elbow, or normal, excuse me, elbow pronation as well. So that's how you can test for elbow pronation and supination. Now, I was gonna put this duck there, but it appears there's another duck there. These things are everywhere, I swear. I have lost count of how many I now have, and I don't want to know, but the score is not in my favor. Now, if you want to actually work on addressing these things, what you can do is you can test, right? How far can I rotate? So let's say your elbow supination is limited, and this is how far you can rotate. Now, this is where the stick comes in really handy. You can then use your other hand on that stick to take it just a little bit further. Now, heads up here, common mistake, especially if you have hypermobility, is cranking on that stick, and one, just cranking it way too far, and two, actually getting it from your wrist joint rather than your elbow joint. So you want to watch, and when you do bring it up a little further, you want to see that those veins on your wrist are actually moving as well, so that the angle of your wrist is doing this. Because for some people, what they'll do is they might be really tight in their elbow, but pretty loose in their wrist. And then when they do this, the veins, or this section, these bones up here, actually don't move at all. They get all of that mobility down at their wrists. So their palm rotates, but the actual angle of their elbow bones doesn't change at all. So you just want to watch that. And as soon as I start lifting up on that stick, I should see that my wrist, or again, the veins on my wrist, start reorienting like this versus just my palm going and that not moving at all. So I can then get into that position, and then I can hang out and I can start stretching here. So this is an easy stretch. I can just start inserting into my day. And not only can I do it at this angle, I could do this at any angle of elbow bend. So especially if you find that when you rotate up here, you're like, oh, I'm way more limited up here. You can grab your stick up there, you can you can torque it a little bit further up here. You can do it at many different angles of elbow bend. There's no right or wrong. And for many people, it's actually helpful to actually work different angles. So bear that in mind. Now, again, let's just say, for sake of ease and demonstration here, we're doing it at 90 degrees. You've hung out here, you've been doing your stretches for quite some time, or you've spent at least 2 to 3 minutes there. You can then start tacking pails and rails on top of this, which would look like trying to rotate out of the stretch, i.e. trying to rotate this way, but the other hand is going to keep you in that stretch the whole time, so you don't actually leave the stretch position. And then you can work up to whatever intensity you want to train that day. And again, this will be taught in the classes, which you can do after this as well. So you can go to the elbow rotation or supination classes, and I'll talk you through this stuff. Now, for most people, I don't recommend starting with max effort if you've never trained this deep tissue in your elbow before. I usually recommend starting with more like 30 to 50% effort, at which point you're going to be holding for more like 30 to 60 seconds. And you would just hold that, and then you can work up to doing max effort over time, which will be done in the classes as well. When you're doing max effort, you only need to hold it for like 10 to 15 seconds. Now, after you've done that, you've tried to rotate out of the stretch, but you haven't moved at all, then you try to rotate deeper into the stretch as if trying to get that stick off of your hand, but again, not by your hand, so not making it happen from this part of your body, but really trying to emphasize rotating your forearms outwards and trying to drive that motion from your elbow. So you should feel a strong contraction in your elbow. And if you're in your true passive range, you might not actually get any further. So you might not actually do a lift off like this. And that's totally fine. It's not expected. You just need to contract that tissue as best you can to try to make that motion happen. And again, you can start with more like 30 to 50% effort when you're just introducing this stuff, and then you can work up to max effort over time. Now, you could do the exact same thing in the other direction for pronation. So if you were doing it in pronation, you would just go, okay, how far can I pronate today? Use the other hand to take it a little bit further. Make sure that you're actually getting that motion from up here and not just from your palm. Hang out there and stretch for 2 to 3 minutes. Then try to rotate out of the stretch, which would be trying to rotate palm up, but not actually going anywhere at all. Holding that, again, starting maybe 30 to 50% for like 30 seconds. Introducing that for a few sessions or a few weeks even, and then slowly progressing to max effort when you feel ready and making sure it's pain-free to do so. Then you would reverse and you would try to rotate deeper into pronation. So you're going to try to make this end of the stick go down, but again, watch that it's not just coming from your wrist, and you're really trying to emphasize making that happen by spinning your arm further in that palm down direction and emphasizing trying to feel that contraction up in your forearm and elbow tissue. So you can use a stick. You're going to find there's various ways that I'm going to teach you guys in the classes, but just to give you kind of a general overview, that's one way that you can do it.